Namaste, I am Dr. Nimisha Jain. I am an endocrinologist at Santokba Durlabji Memorial Hospital, Jaipur. And today we will discuss a case regarding a newly diagnosed diabetic individual. My case, he is a 45-year-old diabetic individual. He is an IT professional and he was diagnosed with diabetes just 6 months back. Talking about him, he is an obese individual. He has sedentary lifestyle. His BMI is 31 kg per meter square. He is hypertensive but is well controlled on ACE inhibitors. He has dyslipidemia with high LDL but controlled on statins. So he was initiated on metformin 1 gram twice a day. Did not come for follow-up for next 6 months. And after 6 months, when he came back to us, his HbA1c was still more than 8. It was 8.2%. So what to do next? What is the next thing that comes to our mind? So first and foremost golden thing in diabetes control is diet and lifestyle modification. So the patient has to be told about the diet and lifestyle modification because he's a sedentary individual and you need to give him advice regarding that. Apart from that, before moving on to the next treatment parameters, if we talk about the UKPDS, which is a benchmark trial in a treatment of type 2 diabetic individuals, then early, intense glycemic control and achievement of strict targets leads to further long-term reduced macrovascular and macrovascular outcomes. So this is a golden thing which was told in UKPDS, and it is called legacy effect or the metabolic memory of a type 2 diabetes individual. So basically, it also said that post 10 years post the trial, the patients who were in the intensive group who had intensive control of glycemia initially, they had lesser microvascular and macrovascular complications later on, even after 10 years of the trial. So even ADA says that it endorses that more than 1.5% HbA1c, if it is more than that 1.5% of the target, then in their situation, starting with a combination therapy, it'll be beneficial. And especially talking about the combination therapy in today's world, once so many CV trials are available. So it says that if a patient is at a high cardiovascular risk, if the patient has an established cardiovascular disease or heart failure or CKD, then definitely SGLT2 inhibitors may have an upper hand in controlling these patients. So if we talk about a very unique combination of empagliflozin and linagliptin, why unique? Because it has complementary mechanisms. So both of these drugs, that is a DPP4 inhibitor and SGLT2 inhibitor, targets the ominous octet of diabetes pathogenesis very nicely. And also because of its pleiotropic effects, it's a very, very wonderful drug. And also it reduces the pill burden. So both the two molecules available in a single pill will provide many benefits, especially in individuals who have high atherosclerotic cardiovascular disease risk factors, and especially in our patient who is obese, who has hypertension, who has uncontrolled diabetes, and who has dyslipidemia, definitely has 3-4 risk factors for cardiovascular disease. So in such kind of individuals, this combination may do wonders. And also, if we say that this molecule is actually very important and alluring in the sense that it gives you an initial time that gives you an early strict control without adding on to the episodes of hypoglycemia, without adding on to the weight gain. In fact, because of the empagliflozin, there may be weight loss. So, and especially in obese individuals, like in our case, some molecules helps in reducing weight. That will be a potential benefit of the molecule. Apart from that, we actually fear all the time that initiating SGLT2 inhibitor will lead to increased genital mycotic infection. So in that situation, also adding on to DPP4 inhibitors leads to lesser amount of genital mycotic infection. So these are the added advantage apart from definitely reducing and getting a better strict glycemic control. So just to summarize, we may adding on 1 gram twice a day metformin to this individual in a particular case where the HbA1c at 6 months is still more than 8%, adding on this combination single pill will be very, very beneficial in my thinking, and it will give us definitely robust HbA1c reduction. And this molecule gives you a promise that 2 to 4 times higher odds of getting the patient near to the glycemic control goal and in lesser time. So basically, it has been seen that in 12 to 24 weeks, the patient may get onto the glycemic control goal. So apart from that, with added advantage that lesser risk of hypoglycemia, even with such good control, there'll be lesser risk of hypoglycemia and there'll be weight loss in obese individuals. So thank you very much.